Hi, it's Lloyd again. In this video we'll look at the boundaries and the joints that make up the thorax. So posteriorly, the thorax is bounded by the vertebral bodies, and anteriorly by the sternum and the costal cartilages, which are connecting the ribs to the sternum. Now, the roof of the thorax are a couple of membranes called the suprapleural membranes. Supra meaning above, pleural referring to the pleura which surrounds the lungs. And it's through these suprapleural membranes that the trachea and the esophagus and the associated arteries, veins and nerves pass to either enter into or exit from the thorax. Now, the sides of the thorax are made up by the ribs and the intercostal muscles. And then the floor of the thorax is made up by the thoracic diaphragm. Let's have a closer look at the ribs. There are 12 ribs in total, and the ribs move in order to allow us to breathe in or inspire, and breathe out or expire. And they can be grouped into three broad categories. Ribs 1 through to 7 are true ribs, and they're called that because they attach to the sternum via their own personal costal cartilage. Whereas ribs 8, 9 and 10, their costal cartilages hitchhike onto the costal cartilage of the 7th rib, or the 7th costal cartilage, to attach onto the sternum. So these are called false ribs. And the last two ribs, numbers 11 and 12, are floating ribs because they don't have any anterior articulation. So let's look at the bony features of a typical rib, and these are ribs 3 through to 10. Posteriorly, we have the head, which will articulate with the vertebral bodies and the intervertebral discs. And just anterior to that is a little tubercle. And this tubercle will articulate with the transverse processes of those same vertebrae. And in between the head and the tubercle is a slight narrowing called the neck. Moving around the rest of the rib, we have the angle and the body making up the bulk of the rib. And most anteriorly, we have a cup on the end of the rib for attachment to the costal cartilage, which will then attach it to the sternum. Now, if we were to then have a look at a typical rib from an inferior view, we would also see the costal groove, which is a groove on the inferior surface of the rib, which helps to protect the neurovascular bundle running between the ribs, the intercostal nerve, artery and vein. So they're typical ribs, ribs 3 through to 10, which leaves ribs 1 to 11 and 12 as atypical ribs. And they're called atypical because they don't entirely fit in with the pattern of typical ribs. So the first two ribs are much more highly curved, and they've also got some bumps on their superior surfaces. On the first rib we have a scalene tubercle for the attachment of the scalene muscles, and either side of this scalene tubercle will be a couple of grooves, and this will be where the subclavian artery and vein lie as they're passing between the thorax and the upper limb. And on the second rib, on the superior surface, there is a tuberosity on the body, and this is for the attachment of the serratus anterior muscle. If we look at the floating ribs, 11 and 12, you'll notice that there's no cap on the anterior end for attachment to a costal cartilage because, of course, the floating ribs don't attach anteriorly. You'll also notice that there's no tubercle, so these ribs aren't articulating with the transverse processes of the thoracic vertebrae 11 and 12, and therefore there's also no neck. It's also worth pointing out that most typical ribs will attach in between two adjacent vertebrae. So they will articulate with the intervertebral disc and then a little bit with the vertebral bodies either side of that intervertebral disc, and this will end up forming demi-facets. We'll look at these in a little bit more detail in a later slide. But ribs 1, 11 and 12 they're not attaching in between vertebrae. They're attached directly onto the vertebral body of their respective vertebrae. And so then there is only a single facet on the head of those ribs rather than the two little facets for articulation with the two adjacent vertebrae. So let's have a bit of a look at the joints now. We have the manubrium as the superior part of the sternum, the body of the sternum, and then the xiphoid process hanging inferiorly. And we have the ribs attaching to the sternum via these costal cartilages. Between the sternum and the manubrium we have a sternomanubrial joint, and you can feel this as a slight sternal angle on your sternum. And this joint is a secondary cartilaginous type of joint. So other examples of these secondary cartilaginous joints are the pubic symphysis and the intervertebral discs. So these secondary cartilaginous joints are only occurring in the midline of the body, and so the sternomanubrial joint is another of these secondary cartilaginous joints. If we look at the connection between the rib and its costal cartilage, they're the costochondral joints, and these are primary cartilaginous, so they're pretty well fused together. However, the joint between the costal cartilage and the sternum, or the sternochondral joint, the first will be primary cartilaginous, so it can't really move, but the second, third, fourth, fifth, sixth and seventh will all be histologically synovial joints and functionally plain joints. So there's actually movement allowed at these joints, which allows our thorax to expand and contract as we breathe. And we can see the seventh costal cartilage, and then where the 8th, 9th and 10th costal cartilages merge with that 7th costal cartilage, they form altogether the costal margin. And you can feel this costal margin on the front of your own chest at the bottom of the rib cage. And underneath the sternum, these costal margins form the subcostal angle. Let's now focus our attention onto the joints between the vertebrae and the ribs. So we have all of the usual features of a thoracic vertebra here, and we can see the rib swinging in to attach to the vertebrae. And where the head of the rib is attaching onto the intervertebral disc and onto, in this case, the inferior part of the T6 vertebral body and the superior part of the T7 vertebral body, this is our costocorporeal joint. And again, this is synovial because there's a movement allowed there which allows us to expand and contract our thorax. Similarly, there are synovial plain joints between the tubercle of the rib and the transverse process of the vertebrae that rib is named after. So the 7th rib in this case is articulating with the transverse process of the 7th thoracic vertebra. And this is our costotransverse joint. So again, these joints are all just named after the bony parts that are articulating with each other. Now this red line passing through the head and the neck of the rib is our axis of rotation. And the rib is going to rotate within its costocorporeal and costotransverse joints to allow movement of the ribs. And these movements will allow for the elevation during inspiration and depression during expiration of the ribs and therefore the thoracic cage. So let's look at a schematic version of this. We can see the head of the 7th rib articulating onto demifacets on the T6 and the T7 vertebrae and onto the intervertebral disc. We have the joint capsule closing off that synovial joint so the synovial fluid can't escape. We also have an intra-articular ligament attaching the head of the rib to the intervertebral disc. And if we now focus our attention on a transverse cross-section through the thorax, there are 4 different joints circled. So joint A, B, C and D. So your task is to name each of these joints and then to state their histological and their functional classifications and the movements, if any, that are possible at these joints. And you can post your answers to this question on the LMS. You can read further about the boundaries of the thorax and the joints that allow the movement of the thorax by consulting your prescribed textbook, your study guide and your principles document. You can also pose questions and discuss this content on the LMS discussion forums, and I'll come in from time to time and make sure you're all on the right track. So, this is Lloyd White. Thanks for taking part.